Hi everyone, big thanks to ICANN for letting me slot this session in as a pre-recorded presentation. I'm coming to you from Waka Waka country. Waka Waka peoples are one of many hundreds of First Nations Australians who continue to demonstrate resilience and leadership despite the challenges that colonisation has thrown their way. I pay my respects to their elders past, present and emerging and thank them for their enormous contribution to our amazing country. I'm Bonny Cumming, I'm a veterinarian and I work for UMRIC, Animal Management in Rural and Remote Indigenous Communities. We're an Australian not-for-profit. And many of you will be very familiar with the topic that I'm going to talk about, Ehrlichia canis, as it's no doubt endemic in many of your countries. However, for Australia, this is a new disease. It was only detected here in 2020, and unfortunately, it has disproportionately impacted rural and remote community dog populations. So for those of you who aren't familiar with it, Ehrlichia canis causes a disease called ehrlichiosis. And this is just a clip from an educational resource that UMRIC put together at the start of our outbreak here.
So what cause tick diseases? These germs live in the blood of dogs that already have tick-borne diseases. The tick is what spread these germs from dog to dog. Without treatment, tick-borne diseases can make dogs very sick or even kill them.
Prior to 2020, Ehrlichia canis was known to occur in a large region throughout the world, many countries. However, it was considered exotic to Australia. However, since 2020, we have had our outbreak here. So it was first detected in a quite remote region called Kununurra in the north of Western Australia, indicated by the red dot up there. And what happened was that a vet in this town started seeing dogs that were presenting to her clinic with unusual severity of tick-borne disease type symptoms. Now, we already had anaplasma, we already had babesia, and so she was used to dealing with these tropical top-end type diseases. However, the presentations that she was seeing were more severe than what she was used to. So she took some samples and sent them off to the lab, and unfortunately, they picked up that we had our first detections of Ehrlichia canis within Australia. Following those initial detections, there was then a surveillance effort that was undertaken by government authorities in conjunction with private veterinary service providers. And many of these private veterinary service providers, I might add, are vets who are working on dog population management programs in rural and remote Aboriginal and Torres Strait Islander communities. What we found was that Ehrlichia canis was really widespread already. It was right throughout the north of Western Australia. It was all through the Northern Territory, which is the middle jurisdiction there within Australia. And it even extended into the northern parts of South Australia. And so over sort of that 12-month period, there were many samples submitted, and it was certainly confirmed that this was not something that we were going to be able to eradicate, that it was well established already. Subsequent testing to that then later detected that Ehrlichia canis was present in northern Queensland as well, initially in the west of Queensland and more recently throughout Cape York through the eastern part of top-end Queensland there. So this is a region where brown dog ticks are very common, certainly, and so we're seeing many cases of Ehrlichia canis within these regions. I think one of the things that first surprised all the authorities looking into this disease was the widespread distribution. However, I guess it potentially wasn't a surprise to others who have worked in remote communities for a long time and recognise the vast distances that people are travelling from remote communities to regional service centres. Now, this is a very old map. It's from 1999, but it asked people to nominate their nearest service centre where they would go and do things like banking. And so you can see, Australia is a big country. People are travelling hundreds, sometimes thousands of kilometres to their nearest service centre. And often when they do that, they're travelling with their family, and their family certainly can include their four-legged members of their family as well. What this map doesn't show is travel for things like ceremony or for kinship relationship practices. It doesn't show things like footy carnivals and sporting events. So there's a whole lot more travel than what's indicated here, certainly. But what's important to recognise from a biosecurity and emergency animal disease point of view is that people do travel with their animals, and particularly for companion animals, human-assisted movement of those animals can be a big contributor to disease spread as well. Now, this is the distribution or the approximate distribution of the brown dog tick within Australia. There's a bit of variability. There's certainly more research that could occur to really identify the regions where brown dog ticks are present, but it's well known to enjoy the hot and humid conditions of the top end of Australia, so the top red half in the darker red. The lighter red are regions where brown dog ticks have been detected, but probably aren't quite as common and maybe are seasonally impacted by cooler weather in the southern parts of Australia. Of course, access to veterinary services in these regions can be really variable. We've got great access to vets if we're living on the East Coast or in metropolitan capital cities around Australia. However, in remote and very remote regions, which are indicated by the cream and the mustard colour on this map, vet services are really hard to come by. And particularly so for rural and remote Aboriginal and Torres Strait Islander communities, which are indicated by the grey dots scattered throughout this map. And you can see there are many hundreds of those. If you take the Northern Territory, one of the jurisdictions in Australia, as just an example, there are only 5 regions where there are permanent vet clinics within Australia. So that's a whole lot of country surrounding these regions where people don't have access to permanent veterinary clinics and would have to travel many hundreds of kilometres to access these services. Health broadly in Aboriginal and Torres Strait Islander communities, particularly remote communities, is sometimes challenged due to a wide variety of social determinants of health and systemic challenges. Things like the distances involved in these remote areas mean reduced access to goods and services, and that goods and services are generally more expensive. At the same time, these regions have few job opportunities and are disadvantaged from a socioeconomic perspective. There's often low school attainment levels. Often people are living in overcrowded and poorly maintained housing. There's often a history of intergenerational trauma, which continues to occur as a legacy of colonisation. And of course, we're working in these regions in remote communities where culture is key. There are so many different language groups and cultural groupings, and that makes it difficult in some ways to deliver services consistently across big regions because it means that you're delivering cross-culturally and often across language barriers. Racism continues to be a big problem within Australia, and that certainly contributes to these systemic challenges of health as well. And these challenges not only impact people within remote communities, but also their companion animals. Certainly all this adds together to add to a layer of household disadvantage, and that means that really people just can't access veterinary services. Even if they have physical access, the financial burden of accessing veterinary services in these remote regions is often too much to bear. And so it's really important that there is charitable or not-for-profit based veterinary services available to these communities. And really that's what has borne the brunt, I guess, of the Ehrlichia canis outbreak within Australia. If you're unfamiliar with Australia, I'd certainly recommend seeking out this map. It's from AITSIS, and it demonstrates a wide variety of different nations that were thought to be present at Australia at the time of colonisation. These all have slightly different languages and different dialects, different cultural practices. So you can see that there's just a wealth of culture within Australia, and fortunately we're starting to celebrate that now, but that has been a challenge over many years prior. And so these things all combine to mean that access to animal health services can be really limited. It's often variable in its frequency and its duration. In some regions, there is local animal health capacity, like an animal management worker or an environmental health worker in some regions. But that's not present for all communities, and it definitely depends on the jurisdiction that you're operating in. There's also really limited resources to support these services. So even where there is animal health programs running on a regular basis, the budgets available to them are really limited, and that can flow on to mean that things like antiparasitic selection is often challenged as well. What we've seen in Australia with the Ehrlichia canis outbreak is a bit of a gap in terms of responsibility for companion animal health and management. Traditionally, companion animals would be thought to be the responsibility of their owners, and certainly our emergency animal disease structures have been designed with that thought in mind. But we need to recognise that in regions where socioeconomic disadvantage and other systemic barriers to health exist, it's not feasible for owners to be able to bear this responsibility when it comes to companion animal, emergency animal diseases. So then where do we turn? Is there an industry? Well, certainly for livestock species, there are agricultural industries, there are peak bodies, there are organisations and groups that are set up that can assist individual farmers if they're struggling with their emergency animal disease responsibilities. But the industry as a whole also comes together. That doesn't really exist for companion animals. So industry isn't really an option. Local government authorities, well, there are definitely many barriers, particularly in remote regions around this. There's a lack of ratepayer base for local government authorities in remote regions throughout Australia. There's really high costs of service provision due to the distances that they're operating in. And there's often really high staff turnover. They're also not really, the expertise within local governments is wide and varied, but it doesn't usually cover animal health as such. So in terms of emergency animal disease management, they're not an ideal stakeholder either. The visiting vet service providers, so typically within these remote communities, a local government or Aboriginal corporation contracts in visiting veterinary service providers to deliver dog population management programs. These are normally a biannual visit for maybe 5 days. They offer surgical desexing or chemical sterilisation and often antiparasitic treatments. Usually due to budgetary restrictions, that's off-label ivermectins. They're also offering treatment, of course, to alleviate animal welfare concerns. Now, the visiting vet service providers certainly have a wealth of information and should be involved in emergency animal disease events. However, they're only in communities twice a year, so they certainly can't be relied on to be there to respond and to be responsible for responding to emergency animal diseases unless they're resourced to do so. Within Australia, we also have a large Indigenous ranger group network that particularly operates across the top end and central parts of Australia. These guys do a really important job in terms of biosecurity risk monitoring. However, they don't have a lot of animal health training. And so even with Ehrlichia canis spreading throughout Australia as it did, that hadn't been picked up by Indigenous ranger groups. So without further training in animal health, then we certainly can't rely on Indigenous ranger groups as our go-to for emergency animal disease management either. They certainly would play an important role though. And then we have state and territory animal welfare authorities in each state. We also have public health authorities that are involved with dog population management programs. And additionally, we've got federal and the Commonwealth level biosecurity and animal health authorities. And these guys all play really important roles, but none of them are based in remote communities. So between all these stakeholders, there's this real gap. And what it can mean is that we see poor animal health on a relatively frequent basis. Things like really large tick populations, which obviously in the case of Ehrlichia canis can significantly contribute to the spread of disease. And we can also see biosecurity threats like Ehrlichia canis go undetected. Within Australia, this disease has been really serious. And I know that in many endemic countries internationally, Ehrlichia canis is sort of a background disease. It just is there. It doesn't cause really significant mortality. That's not been our experience here. And whether that's due to the fact that we've had an otherwise naive dog population, whether it's due to a potentially more virulent strain of Ehrlichia canis, that's all yet to be determined. But what we found is that the treatment with antibiotics, of course, is the recommended, with doxycycline is the recommended treatment for E. canis, but that requires a 28-day course. And given that vets aren't in remote communities on a frequent basis, usually only twice a year, the chances that a vet is there to prescribe doxy at the time that the animal gets infected is probably really slim. So many dogs are going without treatment, unfortunately. Some will still recover and go on to live a healthy life. But we have certainly seen large numbers of mortalities, both at the acute phase and subsequently when they develop a chronic or terminal phase as well. The impacts have been significant. So particularly in the top-end communities, which are warm, humid environments, highly conducive to the brown dog tick, the vector of this disease, We've, based on clinical signs and reports from visiting veterinary service providers, estimated prevalences of up to 100% in some communities, and particularly so at the start of the outbreak when we saw it moving through in waves. There were just these acute waves of E. canis symptoms appearing in communities, and you could almost track it house to house as a result of the clinical signs that would be starting to appear. As I've mentioned, we've seen high mortalities. At the start of the outbreak, we were very concerned about what the chronic cases could mean for communities, and particularly from a public relations perspective. Given the limited access to animal health services, there's often a misconception that animals in poor health are due to a lack of owner care. This is certainly not our experience. In remote communities, whilst they're free roaming, these dogs are owned, they're certainly loved, and they're definitely valued. But there is a common misconception among the general public that this may not be the case. And so we were quite concerned that chronic cases, which would be emaciated, they'd been immunocompromised, and if they were to present with the same sort of pattern that the acute cases had presented with in those acute waves, we were very concerned about both what that would mean in terms of animal welfare, but also what that would mean for the communities caring for these animals in terms of the judgments that would be placed upon them. Fortunately, we haven't seen the chronic cases appear in such waves as we did with the acute cases. They seem to be more sporadically occurring. They're certainly still an animal welfare concern, but from a public relations point of view, we haven't had to deal with big unjustified judgments on communities as a result of this disease. I think it's really easy when we get talking about dog populations to forget that it's individuals that make up these populations, individuals like this pup here. And it's these individuals that might be a child's confidant, they might give a family a sense of security, they might play an important role in the community's kinship system. And so the suffering or death of these individuals is much more than an animal health and welfare concern. And really, the suffering and death of dogs in communities adds to the burden of stress and grief experienced by so many remotely, often as a legacy of colonisation. So this disease, this outbreak, certainly has impact for dogs, but it's had great and grave impact for communities, reminding them of traumas that have occurred to their peoples as well now to their animals. There's been concerns around how we can safely dispose of carcasses, particularly when those acute waves were moving through and the public health risks associated with that. It's certainly stretched already limited veterinary capacity in remote communities. And what we're starting to see, unfortunately, now is that there's increased risks of surgical complications that seem to be popping up as a result of this disease. And we're certainly working hard to mitigate those. I've touched on it a little bit already, but due to their free roaming nature, there's this common misconception that companion animals in remote Aboriginal and Torres Strait Islander communities are unowned and unloved strays. But this is absolutely far from the case. And despite the challenges of access to veterinary services, companion animals are integral to the fabric of remote Aboriginal and Torres Strait Islander communities' cultures. And just as in more accessible locations, they're valued for a wide variety of reasons. They're certainly incorporated into the culture and kinship systems of many communities. Some communities even have them built into the dreaming stories or creation stories of the lands of those communities. For some, they're really important hunting aids, helping to bring food to the table. And for many, they're protectors. They keep both physical and spiritual intruders away. In the desert, they're even a source of warmth, and nights can be described as a 3-dog night or a 5-dog night if it's really cold. And so in terms of the E. canis outbreak, we've seen high mortalities. We've seen 3 in every 10 dogs die in some communities. And so there happens to be 10 dogs pictured on this slide here, 10 dogs with their loving owners. And so which 3 of these dogs would have died from the E. canis outbreak? Is it Robert and his little pup Rocky? Is it Jerica from Manangrita and his adult dog there? Or perhaps it's Frank, whose 3 dogs there are vital companionship and protection. From our perspective, it's just simply unacceptable that there could be such mortality in companion animals without outrage from the general public and a greater government response. We've certainly been advocating for increased resourcing as a result of this event, and fortunately some of that advocacy has been answered, but there's still a long way to go. So I'm well over time, so I'm going to rush through these, but essentially AMRIC is a not-for-profit. We're based in the top end of Australia and we work exclusively with rural and remote Aboriginal and Torres Strait Islander communities. Our vision is for healthy animals, healthy, proud communities. And we deliver this work through veterinary services, education and training, as well as One Health advocacy. Within the canis response, our role has been highly varied. We've done a lot of advocacy work. We've obviously been involved with direct animal health responses in terms of sampling, developing guidelines, assisting with workshops to talk through what the response needed to be, as well as securing pharmaceutical support to try to prevent future occurrences. We've also done a lot of work in the education space, developing a lot of educational resources that are contextually appropriate to remote communities. And a number of these resources we've also had translated into local languages. We've had lots of learnings from this event, but I guess overall, we truly feel that canis is a symptom of a broader problem and that there needs to be far greater resourcing for remote community companion animal health programs. There needs to be greater resourcing for biosecurity and local capacity in communities, and that's something that we continue to work on. We've also done a little bit of work looking at the One Health potential of this event, and on our website we have a literature review summarising the the zoonotic potential of both Anaplasma platys and Ehrlichia canis. So anyone's welcome to have a look at that and download it. It was authored by an Australian expert here, Professor Peter Irwin. The silver linings, certainly this event has been impactful, it's been traumatic, it's been devastating. But at the same time, it has increased awareness of the need for One Health focused animal health and management programs in remote Aboriginal and Torres Strait Islander communities. And so we take that silver lining away and we continue to advocate that message that One Health animal management and animal health and management programs really do bring a raft of benefits, not only for the animals themselves, but also for communities, for people, and for the broader ecosystem. Certainly, the discussions, the experiences that I presented today are not exclusively mine by any means, but instead are made of an enormous amount of experiences that have been provided to AMRIC, thanks to our network of vets, vet nurses, animal health workers, and environmental health workers. So a big thank you to all of those who have contributed their views and perspectives and experiences to this presentation and AMRIC's knowledge generally. This has been a whirlwind. I know I've spoken very fast. Please do feel free to get in touch if you have any inquiries, and thanks for listening.